see how this does. Well, hello everybody and welcome to the Talk at 10. We've literally been sitting here for 15 minutes trying to use this business suite Facebook stuff, and oh Lord, I don't know what else I've been trying to do, but I am not real good at it. So take it for what it is. I'm not a techie person, and in not being a techie person, it just is what it is. So we're going to be discussing post-COVID syndrome. And I'm Dr. Miller. This is Nurse Jessica. We run Integrated Health of Indiana, and we want to discuss post-COVID syndrome. So Nurse Jessica has dealt with a lot of patients with COVID and has done a lot of research on this, so she knows how to help her patients. And I've done research on this, and I look at it as looking into the tinkering of what makes the body do better. How do you make yourself more resilient? If you watched last week's video on this, we were talking about the building immunoresilience and using stuff like making sure your hydrochloric acid in your stomach is good, making sure that you will battle bacteria and viri naturally, not allowing them to take hold in the beginning anyway. And with that all being said, I am going to try to get on here to answer questions. Once again, I'm not very good, so if you get in here and you do ask a question, if I don't answer it live or she doesn't answer it live, we will get it posted to this video so that everybody can see it. And with that said, I am going to turn it over to Nurse Jessica.
No, I think mine's working. Well,
We'll get better.
Well, I was asked to talk about post-COVID syndrome, and I take care of the COVID patients in the hospital. I don't get to follow them after they leave. I've gotten sick. I don't know necessarily that I've had COVID. I've never been tested. I've also never been tested for my antibodies, but I probably should do that. But I actually got sick way back early on before COVID was cool. Had a patient that had a high fever and initially tested negative for the flus, and within 24, 48 hours, I was sick too. He ended up testing positive for the flu eventually, but looking back, I look at all the symptoms that I had, and I could have had COVID, and that was in March, early March or late February, and then my symptoms lingered for a long time, and I suffered at home, because of course I did, because unless you're dying or your arm's cut off, you don't go to the emergency room when you're a nurse. So my actual oxygen levels got down to 82%. It took them almost, what would we say, 7 months almost? Yeah. 8 months before they became, between 92, 94%. And now we are 10, 11 months out, and I'm just now bouncing back to my baseline. So regardless of whether I was positive or negative, because I don't really know, the COVID syndrome really intrigues me. And I see people that have had COVID. We've had patients with COVID, and then their symptoms kind of linger. So I wanted to talk a little bit about what the symptoms are, kind of what I've seen in myself, whether it was flu, another illness, or COVID. I just thought it would be interesting to talk about what the symptoms are, and then Dr. Miller is going to kind of tell you what we can do about it, because we've kind of changed the way we live, and we are always tinkering with it, of course. And then we've added some more supplements, which actually has really helped me specifically. So I always like to talk from personal experience or experience between us that we can actually share. And so Mayo Clinic, I do like to tinker around and research things, especially at nighttime. Cause I like to benefit ourselves as a family, myself, and then as a nurse and patient. So they call this the, and this is always evolving and changing. So even the articles that I found, we're still learning. So we're gonna learn from this.
Well, it's learning and changing.
And yeah, it's ever changing. So the thing that is really frustrating as a nurse in the medical field, and I watch my friends, the MDs who are awesome and take care of our patients wonderfully. It's just every 15 minutes they have a new baseline. So they actually never really have a baseline. So we can tinker and mess with things and change things, but every 15 minutes it's going to be different. And you can never just start from one platform and change something and then figure out if that's working or not, because the baseline's always changing.
Well, think about this, and this is just a little aside. A lot of the functional medicine doctors call this an acute disease on chronic problems. Our lifestyles, what's one of the number one comorbidities that cause issues for people with this? And that's high blood sugar. So if you have high blood sugar, you immediately start to take your legs out from underneath you. And so you have a chronic problem there, if you have a chronic problem there, if it's always high. So if your blood sugar is always high, and it has been high, but you just dealt with it, or you didn't even know you had it, which a lot of people are that way, or you're taking metformin or insulin or something like that, your blood sugar is high, and that immediately puts you at risk for worsening symptoms. You have a chronic problem, and now you have an acute issue on top of it. So that's where you really, really have to pay attention, and that's why it's always changing. So.
Well, not only is it always changing, but you can have 15 people in a room that's had COVID, and each person will tell you a totally different set of symptoms. And the people that have had very, very mild symptoms end up sometimes having the worst fallout from those symptoms later. So people get COVID and don't even realize they've had COVID. Then you have people that actually get super, super sick, but the symptoms are always different for the individual. So long-term effects, or they call these long haulers. They've just kind of termed them long haulers with these COVID things. So this is from Mayo Clinic. And again, even in this article, they say they're continually learning, so this is continually changing. But most people will get over the coronavirus in a couple weeks, but they'll experience different symptoms long after they've recovered from the initial sickness. So a lot of these symptoms are the same, and I did 3 different articles, but most of them were the same. So I'm going to tell you what they are, and then I'm going to tell you kind of how I dealt with the same symptoms over the long haul. So fatigue, like chronic fatigue, just feeling tired no matter whether you're having sleeping issues or not, even when you go to sleep and sleep 8 to 10 hours a day, which I do because I do love my sleep. You would still wake up tired. So this is just being tired where it affects you throughout the day, even when you're getting good sleep. Shortness of breath, that can last for months. Cough, chronic cough, joint pain, chest pain, muscle pain, headache, faster pounding heartbeat, loss of smell and taste, memory, concentration, or sleep problems, rash or hair loss. So I'm going to just tell you a little bit of...
I laugh. Hair loss.
I'm not sure that that's COVID related. So I'm going to tell you these symptoms, and then Dr. Miller is going to tell you a little bit about what causes it and what you can do about it. So for myself, fatigue is a huge thing. Once I had a cough and shortness of breath for a very, very long time. Like I said, it took a long time for my oxygen levels actually to recover. I'd get winded coming up 2 steps coming up the back deck. Just to get into the house. But the joint pain, so just a little underlying information. I have problems with autoimmune disorders in my family. pretty sure that I kind of got some of that in my DNA here. And then I have big issues with leaky gut, food allergies, allergies to medicine.
You could compound that with auto accidents.
Yeah, lots of auto accidents. So, do I have a chronic issue with an acute issue that just exacerbated everything? Possibly. So we're kind of fascinated with that. So I always have joint pain, but I didn't have joint pain like this. This is like a bone crushing joint pain, and you can't get comfortable no matter what you do. Chest pain, that comes from cough a lot of times. Or a lot of times you get pneumonia. You recover from the pneumonias and you just get like these little stitches in your lungs, that pleurisy. You get some inflammation. The lung sticks to the lining of your body cavity and it hurts.
It's a sharp pain.
It is a sharp pain. Just muscle pain, headaches. Headaches is huge, and headaches, we see that all the time in the clinic, especially post-COVID and with COVID. If that's your symptom, it's extreme headache. And I have a history of headaches, but my headaches have kind of resolved in the last few years. I got them back when I got him. Yeah. But they have been accentuated in the last year.
That's not me.
Yeah. Faster pounding heartbeat, which I thought was kind of interesting because I started getting, and it can be caused from anxiety, and I am high anxiety sometimes. My life is high anxiety. However, I started getting heart palpitations, and then I started telling him about it, and then I started paying attention. So I got this cool little watch, and then I had an Oura ring, which is super cool too, but it died. So we got to figure out how to get that back. But it would check your heart rate. And so I would get tachy, which means greater than 100 beats a minute. And I would be in the 140s just checking out for no reason. I just woke up or I'm just sitting there and you get lightheaded. And so once I started researching it, we found that could be related to illness. Loss of smell or taste. I don't remember losing my smell or my taste, but I didn't really eat, so I didn't really care. Memory, concentration, or sleep problems, brain fog. Now I have noticed brain fog, and some days it's really bad, and my friends will talk to me and they'll be like, I just told you that, or you did that wrong again. And I'm very aware of it, and in certain instances I am so aware of it, and I feel like I'm fighting through it, that I don't put myself in a position where I could harm people, because it's like Charlie Brown and his little psychologist friend. They wah, wah, wah. So I can hear you talking to me, and I'm listening to you, and it's just fighting through it. Rash or hair loss. So I don't think I lost any of my hair, but some people that have COVID, they get redness in their fingertips and their toes, and I actually have seen it, and it's kind of bizarre. But the ends of your toes, your fingers will get bluish tint, but they will get this reddened rash. And I think a lot of times it's more prevalent in little kids, but you don't even know they've had COVID, but they start getting these discolored extremities. So those are the symptoms. And again, they're ever changing. And they have related this to damage to the heart, to the lungs, and the brain actually. And I thought was very interesting that it actually, they think is going to predispose a lot of people to Parkinson's and Alzheimer's, which is interesting. We have a lot of friends with Alzheimer's. We have several friends with Parkinson's, and so I'm kind of interested in following that.
Well, my
figuring
ATOE
that
status.
Yeah. So now that I've shared a little bit about myself and these symptoms, I'm going to let Dr. Miller talk to you about why.
So what we did with Jessica with the pain, and you got to remember that this is done over a period of time, because she maybe got COVID when COVID wasn't cool. We're not sure. And so we're looking at how to address her underlying autoimmune issues, as well as making her healthier, more immunoresilient, building everything up. And we've tried a bunch of different supplements and supplement companies.
Yeah, and I hate supplements. Not that they're not good for me. I get it. I get pill fatigue quickly, and I have texture issues, so the shaky powder things really
They're
gets
no
me.
go for her.
So we've tried lots of things. However, this last go round.
Yeah. And so
It'd be
in
awesome.
Oriental medicine, I do acupuncture also. And so in Oriental medicine, less is more. So the pinnacle of doing acupuncture would be able to take one needle and you hit that one spot that ties it all together. So I don't like to prescribe 9,000 different supplements. I'm sitting there thinking at the same time, I'm the person that does take 9,000 million different supplements, but it's all in self-discovery and watching my tracker, taking my blood and doing that. So we started using liposomals with her, and we've seen a very good response with using glutathione, which is one of the master detoxifiers in the body. We also use a methyl booster, because if you don't have methyl groups, you can have all the glutathione in the world. It's not going to work to detoxify. This is an underlying thing that is taking care of the chronic issues, and then how do we deal with the COVID issues? And the COVID issues, once again, that's pretty simple. Your vitamin C, your zinc, your copper, make sure your vitamin D is between 40 and 60. You want to make sure you're getting plenty. You can do the zinc tally test to taste to see if you need zinc or if you're taking enough or not enough. And those are just supplements as you're worried and going forward. I want to talk about the underlying stuff. And so when we look at something like this, this is a test that we do that tests omega-3 fatty acids. So if you're ApoE34, you are predisposed, or ApoE44, you are automatically predisposed to having issues with inflammation, and you most likely have problems taking fats and moving fats around the way that they need to be moved. So when you're taking omega-3 fatty acids, those automatically bring down inflammation, systemic inflammation. And so we do an omega-3 test, and this is a hypothesis that is being vetted out. I listen to Dr. Peter Attia, you've heard me talk about him before, and I listen to a lot of the other researchers. And what's being vetted out is because we already have cardiovascular issues, they've seen scarring and plaquing in teenagers now in America. That's how poor our lifestyle is. Our lifestyle is starting to kill us already when we're in our teens. And if you look at this, this is the omega-3 test by Lipid Labs. And the average American, will you hold this for me a second, huh?
Yep.
I want them to, I really want to show them. I don't know if anybody's posting any questions yet, but the average American, get up here personal. Oh, that's too bright. Down here, oh, how do I get that in? Okay, down here, you start to see, this is where the super healthy cohorts are. So these people, you're looking at Greenland, Japan and stuff like that, they don't die from cardiovascular disease. If you look up here, where's the United States? We are at the top of the chart for least healthy cohort and most likely to die from cardiovascular disease. And so what you're seeing here is, see that star in the middle? I am just about to cross the line, and that's where I want to be. Actually, I'm due. The most recent test that I have is 6 months old, and so I need to retest this. But this is one of the things that we see that gives us an underlying problem. And so when you hear the medical doctors and you hear the news talking about comorbidities, you really need to know what the comorbidities are. So if you want to be healthy and you want to be immunoresilient, those comorbidities are the things that, when you go to your medical doctor, you typically go when you're already in crisis. And if you're not in crisis, a lot of medical doctors are trained for crisis. And so they want to take care of you. But as some of you may have already gone,
symptom management.
Yeah, as you've already gone, if you have a blood sugar of 126, oh, you're not diabetic yet, we'll wait. And don't think that I am dissing the medical doctors, because I'm not. They're highly trained and they're very good at what they do. I do not believe that they have been educated yet in the wellness, bringing out true wellness, because the tools that they are given are pharmaceuticals, and the pharmaceutical reps are the ones who teach them how to do this.
I'm going to add something to that. I don't know if this, I get that, but we as a society,
oh yeah,
we my friends don't get to practice medicine much these days, because we expect or dictate in some cases what we want, and so people don't value wellness care. They prefer a script for their dollar. So unless they walk out with a script, they don't feel they've gotten the bang for their buck. So I think that MDs and physicians try as best they can, but we as individuals, and I'm talking from my personal experience in the healthcare field, we almost live our diseases at some point, and we just want more and more and more, and scripts are what people want. They want the quick fix. They don't want to do the healthy habits.
Well, it's for those of you with children, and your kids are sitting there going, Mom, 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 Dad, 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 and you say, no, 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 and then they keep coming back, and then finally you're like, here you go, just to satisfy them. That's kind of what we put, or where we put medical doctors. Now, standard of care, which is dictated by the government, does not allow them to do a lot of preemptive stuff. And around here, so I like to do an NMR test. So why is that? Why would that be important with post-COVID syndrome? Because the NMR test shows us if you have high triglycerides. It shows us if you have Lp(a), which is a form of a fat that is very atherosclerotic, so is ApoB 100. These things are the things that if you know that you have these, then you start to change. But before you come into my office, or before you go talk to your medical doctor about these things, if you don't want to affect a lifestyle change, and I have this talk with my patients all the time, if you aren't willing to learn how to cook or cook, slow your life down, which is not a bad thing. If you're not willing to do these things, don't waste your money.
Well,
and don't waste my time.
but it works, and I can speak to my personal experience again, because I was in and out of the doctor's office because I had stomach issues, swelling in the legs, weight gain, migraines, anxiety, And then I met Trevor, we changed all of my diet, and within, 6 months? There was no swelling, no stomach pain, my hair grew back, and that was just a lifestyle change. But you have to be willing to do the work and sacrifice a little bit.
I wouldn't call it a sacrifice. I
Well-
mean, lifestyle is killing us.
You can have everything you want, or if you have to be able to compromise and
You
tweak
have
it
to
a little
be,
bit.
yes. And so since this is about post-COVID syndrome, when you already have lung issues, you already have high blood pressure, or you already have brain fog, this is just going to come in there and make those things worse. So to help your body out, right now there is no magic concoction. There is no magic supplement. There's no magic drug. You have to go in and do the things that make your body, once again, resilient. And how do you do that? You get rid of processed foods. You get rid of the excess sugar. And those become treats or special times. We went out for New Year's and I had a couple of drinks and we shared a couple of desserts.
And we left some on the table.
Yeah.
Actually, it was one dessert, and we shared it, and it's still sitting on the table.
Yeah, and so, not that we didn't enjoy it,
Oh, it was wonderful.
but there also comes a point in time when you take a swig of a soda and you're like, whoa, that is so sickening.
You find that your taste buds change.
Yeah.
And then what you used to just love or crave was like, yeah, I don't want that anymore.
So as a prophylactic in our house, and just to take it a little step back, people in our house that were on medications are now no longer on any medications, correct?
Most all of them are gone because we've replaced it. Well, we did not replace anything. We added to, and then the doctors were able to wean because they weren't having the test results were amazing. So we were able to wean off of almost all meds. We have PRN meds, but we use
They've
almost
expired now more so than.
Yeah, we almost use entirely, our baskets are entirely full of supplements.
Yeah.
Very rarely we have a script.
So what to do for post-COVID syndrome? If you've lost smell, if you have brain fog, one of the first things to do is if you have access to what is known as GABA aminobutyric acid, if you take that and you get calm and you get this feeling of euphoria, that's a sign of leaky brain or leaky blood-brain barrier. And so we know that you're absolutely getting into too much sugar. Actually, probably your insulin is too high. And so we need to cut that back and rebuild the blood-brain barrier, get rid of the brain fog. We do that with her because she's going through the stuff for the leaky gut. She's going through the stuff for
Mold toxicity. I've had mold toxicity.
Yeah, the house was riddled with black mold. So we've gotten rid of those things and started to amp up her detoxification pathways using AMPK, using methyl charge, using glutathione. So her detoxification, which is everybody's primary system to get stuff out, we've really turbocharged that. As we turbocharge that, then we start to look at, okay, if you have smell issues, then nebulize glutathione and the methyl stuff. So it goes directly to the lungs. I haven't had a chance, we haven't found the nebulizer.
No, we were looking.
So that's one thing to do. If you have lung scarring and you're having a hard time breathing, that's one of the things to do. That glutathione, the bringing the blood sugars down, which is about insulin.
Make sure your glutathione, if you're going to nebulize it, that it's made to be nebulized.
Yep. And high dose vitamin C. High dose vitamin C helps everything in the body. And you have to do this over and over and over again. It's not one of those things where we've been spoiled by medicine, because medicine absolutely works when appropriately applied. And so going and taking an antibiotic for 10 days and getting rid of stuff, or taking an aspirin and getting rid of a headache, these things they do great for masking what's happening, and they do get rid of the pain. But we're spoiled. We think that should happen all the time. And, we actually had a discussion today about some research that came out. They're talking about the use of Tylenol to knock down fevers. And we used to give Tylenol, as soon as a child had a fever. And now these researchers are starting to say, no, let it simmer. Let it get up there a little bit. Give the body a chance to fight. Give the body a chance to build an immune response so that it learns. And then if the fever spikes or goes way up there, that's when you can start to knock it down with these things.
Well, and that's what the body's designed to do. It's designed to ramp up and get a fever systemically, it kills germs throughout.
Yeah.
So if we're getting into symptom management. Nobody wants to be uncomfortable, so everybody wants to jump in and alleviate all the symptoms. But that's not necessarily the best thing for your body.
And we fight very hard to maintain a lifestyle that is literally killing us. I mean, the research shows we're last in cardiovascular disease, and we want to mask every little sign and symptom because we think we've been taught by commercials and marketing that the body is just designed to break. It's not. It's designed to adapt and overcome. That's what it does. And it's not designed to, if you've got a headache, if you have a migraine, that is a lack of Imitrex. Your body doesn't even make that. Your body doesn't make acetylsalicylic acid. Your body doesn't make these things. There's a problem and a reason. Can it be an acute exposure? Can it be something else? Yeah, it can be. But typically, you just got to give the body time and start to think about our food issues are the things that have really, really befuddled us the most, because you can have a reaction depending on how healthy you are almost immediately when you eat the food or up to 72 hours later. And at 72 hours, you don't even think about it could be something that you ate. And that's how we're talking about chronic problems with underlying hyperinsulinemia, underlying blood sugar issues, underlying autoimmune issues, underlying all these things that are there. And then you throw in COVID. Why can I not sit here and say C, zinc, copper, vitamin D? That whips it. It helps make you resilient to it. But if it was that easy, then you wouldn't have been busy the last few months.
Still wouldn't be in the pandemic.
And so with that all happening, you have to know what your underlying issues are, and you have to be working on those. And then when things like this come along, they don't hit you as hard. And that's the acute on the chronic.
We hope not, anyway.
Yeah. So with that being said, I can't think of too much else to do. Let's just take a moment and talk about where are we at now on this. I think we're at about 35 minutes. Let's go back and revisit immunoresilience. What are the things that we work on all the time that talk about your morning habit? I'll talk about my morning habit, and you all can get an idea of the things that we do health-wise to make sure that we're doing better.
Well, my mornings are crazy, but I really do enjoy waking up nicely, quietly, and having coffee, and I take my supplements, and I like to walk, and I used to like to swim. Of course, COVID kind of knocked that out, and I'm not the best at meditation, although I have added that, and I do listen. That's kind of what I do.
So I wake up in the morning and got to give a kiss, because otherwise she comes after me. And I will go out front, and because I've had some issues with bacterial overgrowth.
And actually, I do like my Hugs vet. That's actually good for you.
Yes, hugs and kisses, raise oxytocin, touch,
It's good for
cuddling,
your immune system.
snuggling, yep, that all raises immunity. So when we start to look at this and we take, so I start my day, I go out, I take my, I actually take biocidin and I take Oliverax. I will do the glutathione and stuff like that, because in my genetics, I have seen where I have lacking issues and I want to bolster those. And then what happens is I will sit down and do my meditation. My meditation takes 20 minutes. I do deep breathing after that. And once again, I monitor it so that I see how my heart rate variability is after. I mean, I'm not doing the meditation and looking and doing them. It's I do it and then I look and see, am I stressed? Is there a reason why I'm stressed? And what's going on? How this relates to post-COVID syndrome, when you take down your stress levels, you take down cortisol, which is your stress hormone, and you don't do what is called a pregnenolone steal and all these other things that you guys probably don't care about, and I'm not going to quiz you on. So after I do my meditation, after I do my breathing, I will get up, because that's been about 20 to 30 minutes. I take a binder. So for people who do things to get rid of bacteria, candida, sugar, when you're doing those things, which is very good to do to fight post-COVID syndrome, to fight COVID, to fight illness, because you lower the load on the body, you lower the stress on the body. You need to take a binder with that, and we use stuff called GI Detox. You can use bentonite clay, those types of things. They bind, and then you excrete it out, and that's to help you get rid of everything. Because if you have leaky gut and you start to kill stuff off, if you don't move and evacuate, it goes right back into the bloodstream through the leaky gut. And so you want to bind that and get it out. After that, make my coffee. You saw me drinking it earlier.
Sometimes I make his coffee.
Sometimes she makes my coffee. I'm usually up a bit earlier than her. And so I drink my coffee. My coffee has turmeric in it, cinnamon. I use the golden fusion stuff. That way I just don't have to have a bunch of things and mix and match.
And sometimes it gets psyllium husk in there by accident.
Yeah, that was the first mistake of the new year for me. It was thick. And I typically do not eat before like 10 or 11 o'clock. And so you have to take that in context. My context is APOE 3-4. I have been pre-diabetic. I have had systolic hypertension. We know that I have issues with glutathione, and I have issues with, well, wheat and stuff like that. My genetics show that. And so I want to give my body as much a rest from insulin as I can. And then once I eat at 10 or 11, I have until 6 or 7 at night to go throughout the day and then stop. I have found through monitoring my sleep that if I eat at the latest at 6 o'clock, that's when I get my best sleep, because we're usually in bed by 8, 8:30, 9 o'clock at the latest. Once again, these are just things to take off the load and bring the body down. And not bring the body down as in make it sicker, but just relieve the stress. And so as you are taking the the stress off the mind and off the physical body and stuff like that, it can react better. You know, there are days, if you think about it, for those of you with children, if you think about it, if you're sitting there and you're in a chill mood and your kids are coming by and just being kids, that doesn't bother you. But if you're highly stressed and you're anxious and you're just waiting for the next shoe to drop and whatever else, and your kids are running around and they're driving you nuts, you're more likely to snap or to yell at them or do, and that's more of a sign of stress than it is anything else. Your ability to not react, but to think about it and then do what you want to do that's basically intelligent. If we're snapping and having snap judgments and reacting, you know, there's a couple things that can be going on there, but ultimately that keeps you in this stressed cortisol state, which does not give you flexibility to be able to deal with things. And so that's it in a nutshell. That's my base. And then if something happens, so, you know, I'm not going to make any money off of my base, because you can make coffee, you can throw turmeric and cinnamon in your coffee, you can meditate for free, you can get your sleep for free. You know, this is just about us helping people be healthy.
Can I add something about your ring?
Yes.
So the rings are cool. The watch is super cool. And I feel like
I put those in.
From a medical perspective, these things get smarter and smarter. So this watch actually monitors your pulse and the oxygen levels all the time if you choose it to. The ring, we've learned the ring, because the ring was the first thing that we had. We could see that we were getting, the ring learns you, and apparently the watch learns too, but we've had the rings for a couple of years now. And we've been able to see that we were getting sick several days before we actually got sick.
Yeah, your
which is
temperature.
fascinating, especially at nighttime. You could, the sleep pattern changed, the temperature changed, because I don't think the watch does temperature, but the ring did. And your heart rate variability changed. So almost every single time that we got sick, which was very rare that we get sick, but we seen it at least 48 hours before.
Well, the same thing that makes me ill, when I drink alcohol, even one beer mimics stress in me. So if I'm going to drink a beer, I need to drink a beer very early in the day, so most of it is metabolized out of my system. And heart rate goes up, temperature goes up.
They're great tools for health, and you can actually learn a whole lot about yourself, and they're just awesome tools.
Where doctors or teachers come into play is when you have something you cannot figure out, because that's what we're good at. That's when we're good at digging in. And that's like with post-COVID syndrome. What symptoms are lingering in you? What symptoms do you have? If you have joint pain, okay, let's look at uric acid levels. Let's look at inflammation levels. Let's see where you're at. But then we start to address it from there. And that's why the golden fusion that I use is awesome, because turmeric just takes down inflammation. Omega-3 fatty acids take down systemic inflammation. And these are things that you can do that just are, they're like putting on chainmail. They're just getting you ready for battle. And they don't do any harm. So that's why I always look at it as, if there's no backside risk, I mean, it costs money, but that's okay. Well, we can make more. Money's not my God. I want to be around a long time to see my children and grandchildren and great-grandchildren. And ultimately, I want to play with them. So if I'm buying supplements and using those to give me a baseline of health, you know, when I was sick, I wasn't really down. I don't really get sick. Kidney stone, that kicked me in the, that brought me to my knees.
And your ring told you were getting
Yeah.
a couple days before that too.
So that's a funny story because we went to Chicago and I didn't really drink in Chicago, no water, no fluids. I felt just a little off. And typically when I feel a little off, I just listen to my body. My body did not want any food, didn't want any water. I just was like, okay, this is just going to be one of those times when I fast for a while. And the stone that I had looks like the stones. I'm sending it off to the lab.
It's like a mustard seed.
It's teeny tiny. You would never think that that this fleck could cause an issue. And I'll be very honest, I was mad. I was like, why am I of all people getting a kidney stone? I don't drink sodas. I don't do this, that, and the other. I don't drink alcohol every night. I don't even drink it every week. It's like, there is no reason. I don't drink fruit juice. There's no reason for me to do this. And we looked it up, and they can form in as little as a week if you dehydrate yourself. And I was like, oh, well, that makes sense because we do eat high oxalate stuff. That's a little inside baseball for those of you that aren't doctors, but I do eat lots of spinach and lots of things that form stones. But typically, if you're drinking enough water, your body takes care of it. Well, if you don't give the body what it needs to take care of it, then it's not going to come in and fix stuff for you. And so that, we believe, is why, because in Chicago 2.5, 3 weeks ago, 4 weeks ago now, that's why I formed this stone. And man alive, I actually did go to the hospital because I did not want an appendicitis. And so I wanted to be made sure that I didn't have an appendicitis, but I was having that pain right here. Fixed me right up, passed it the next day, and all was good in the hood.
It was so bad.
I don't get sick. I rarely ever vomit. And it had me dry heaving.
Well.
And she was like, you're sick? You're throwing up? We're going to the hospital.
And you didn't complain.
Yeah, no, that was one of those where I was like, I'm going to ride this out. And I rode it out for about, an hour?
Yeah, and I think that's where we just, we kind of wrap this up with pay attention to your body. So if you have lingering symptoms and you've been sick and you're having issues with heart palpitations or you're having chest pain or lung twitches, please see somebody that can monitor that, whether it be your primary care physician or somebody else that can follow up so that they can get you to the people that you might need, such as a pulmonologist or a cardiologist, because you want to keep the organs inside your body healthy so that you can keep your body healthy. But we are here on Thursdays to have fun, 1, and 2, to help you live a healthier life by sharing with you the things outside of medicine and outside of the medical world, such as chiropractics, acupuncture, nutrition, functional medicine.
Working on the 4 pillars.
Yeah.
Sleep, nutrition, movement, and community. And the healthier we can make our community, the healthier we all are and the happier we are. I mean, people at the last moments of life don't sit there and talk about money. They talk about the ability to have loved their loved ones.
Time.
Yeah.
I can honestly say in almost 12 years of nursing, they aren't worried about the things that we worry about. They want somebody with them, 1, they do not want to be alone, and 2, they wish for time. So that actually makes me tearful because COVID has actually taken that away. So I'm at the bedside, my friends are at the bedside, and they're alone. So say a little prayer for those people. Keep yourself healthy so you don't find yourself in that situation, and keep your family healthy so that you don't have to be the one on the other side of the Zoom camera while the nurse or the doctor is holding their hand.
Yeah, we've both lost people we know to that.
Yeah, we have. And, on another note, everybody's like, oh, it's the old people. No, it's not really. And for one instance, it's super sad. I have a friend,
Just
early.
one.
Yeah, I don't have, my circle is very tight. I will be honest, it is very tight, but the ones that I have, I hold very close to me. And I had a friend that I was made aware of. He's young, he's 40s. He got COVID, high fevers. Not exactly sure what happened, but he did throw a blood clot and had a stroke, a massive stroke. And he was that 1% way extreme. He ended up with craniotomy, which is taking off the skull so that the brain can swell. They removed the blood clot. He ended up having part of his brain removed. Got massive infections. So this, I think, started in June, and we're in January. They put a prosthetic cap back on. Apparently the infection came back, so they've had to remove that since. So he is on home infusions of antibiotics, and hopefully that takes care of his infections so that he can have surgery, I believe in February, to have his skull cap put back on. And hopefully he doesn't have any issues in the future. However, the last time I was able to hear about his update, he had lost a lot of his ability in his left side and lost his peripheral vision. So, it doesn't just affect old people. It doesn't affect just people that are sick. He's a very healthy guy. But, it does happen. COVID is real. The symptoms are one extreme to the other, and we just like to try to help keep everybody as healthy as we can, so that they don't have these issues. But remember, there's a lot of people that are hurting, that have been affected, that have lost a lot of their loved ones, and it does affect your we hear hero a lot. We're not heroes. We don't feel like heroes. We can't save everybody, and it's really frustrating for us, because we want to. So keep yourself healthy so I don't cry. And we don't have to hold your hand at the bedside because there's nobody there.
Thank you. Be healthy. Any questions? We will post this up on the Facebook, and we would be happy to answer them. Thank you. Thank you for taking this time to look into the health of you and your loved ones. This broadcast does not constitute a doctor-patient relationship. It is intended for educational and entertainment purposes only and is not a replacement or substitute for care. If you are having issues, please seek a qualified professional trained in functional medicine. We would be happy to be of assistance with both in-person and virtual consultations. Thank you.